Violence in the workplace really impacts people. Over a third of people, once impacted by violence, consider thinking leaving the organisation, which is a real challenge, of course, for the individuals impacted and indeed for ourselves. So it's really important that we're able to do all that we can to help reduce and prevent as much violence in the workplace as possible. It's not a challenge that we're shying away from. This is something clearly demonstrated within our strategy and by our partners coming together to make sure that we can make a difference to people across Sussex. It's a trauma-informed with a public health-focused strategy, and you'll hear about that in the rest of our video.
Having a system-wide collaborative approach rather than specifically a trust approach really benefits the ability to be able to share ideas, to be able to look at some of those more core system-level issues and work together to be able to provide a consistent response. Working collaboratively as a partnership has really benefited Sussex Partnership Trust. As a mental health trust, we do have high numbers of incidents of violence and abuse, and the ability to be able to work with the Integrated Care Board and our partners across the integrated care system has allowed us to embrace the new approach that NHS England are looking at, being able to tackle these events of violence and abuse.
So in Sussex, we are a violence reduction partnership. We are one of 20 violence reduction units funded by the Home Office and have been in operation since July 2019. VRUs were designed to specifically tackle public place youth-related violence, but the remit of those VRUs has expanded well beyond that. We think of lots of different public spaces, including health and care settings, so hospitals, for instance, or GP surgeries, or minor injury clinics. Any of those settings are classed as public. ICBs, so part of health and care across Sussex, they are a specified authority under the serious violence duty, which means that they can now sit at our partnership, and we are then able to share our learning and our expertise in terms of reducing violence. So what we would like to do now as part of the serious violence duty, which came into implementation on the 31st of January this year, is to define that relationship more.
We've definitely learnt a lot more about being preventative rather than being reactive. So we're learning more about trauma-informed approaches, as well as embedding that public health approach and trying to be curious, trying to ask questions, trying to involve staff in the solutions and the decisions. Violence against our staff is absolutely important, but it needs to be involved or included in all those other conversations that all link up: civilities, respect, well-being, making people feel valued and want to be there.
We're developing trauma-informed principles and approaches so that we can help support our workforce. I mean, if you've got plants, if you've got decluttered notice boards, if the layout is fairly simple, if the access is open so people can see that exit, those simple little things can make a real big difference to somebody that's approaching the services that may feel anxious. Violence and aggression normally comes out through anxiety and fear. So as people approaching a service, does it feel trusting? Are we going to step back if somebody feels nervous? Are we going to recognise that and step back a little bit? And so all those little differences can make big changes in the way that we approach service users and carers, which will help to reduce the violence and aggression we may experience in our services. Who doesn't want to work in a more friendly environment? Who doesn't want to approach somewhere where they can feel helpful, where they feel like they've done something for somebody? If you're if you're making people feel safe, that will make us feel good as people. Just let's say again, those simple differences that we can make in lives for others actually help us as members of the workforce as well.